Well, good morning, everybody. Know most of you here on the call, but for those that don't know me, I'm Todd Ogden, president of the Downtown Lincoln Association. And we are happy to have this webinar today. We are fortunate in Lincoln to have wonderful service-oriented associations and organizations, which DLA here is fortunate to partner with many of them as we talk about situations along the streets in downtown, whether it's individuals experiencing homelessness or panhandling or loitering or anything like that. So it's something we've always wanted to stay on top of as an organization and do what we can. And a couple things have happened over the years, which has helped improve that. First of all, one of the major changes we made was, gosh, it's been almost, Matt, maybe we've partnered with you for 6 years now, maybe 7 years. And we have partnered with Centerpoint and helped contract to have a social worker downtown to work with outreach, peer-to-peer support, and extra boots on the ground to help our businesses and individuals downtown on really any situation that could arise where people don't know exactly how to handle a certain situation as a business. So that's been going great. We've also, with the help of people like Tara at the Lincoln Children's Museum, brought together a group which we now call the Downtown Systems Response Group that has organizations like LPD, Cedars, Matt Talbot, Centerpoint, DLA, Urban Development, and several others get together and have meetings every other month or so to talk about any systems response, whether it be any of those social situations we talk about. And our goal today is to update our downtown community and surrounding community, especially those frontline workers who may experience certain situations so they feel comfortable in how to handle it and understand what we have working downtown and just where we're at. I think, again, we're very fortunate to be in the situation we are. It's all relative, and Lincoln is in a much better space than a lot of other downtowns, certainly, and we want to keep it that way. And it's all starting and stopping with the partnerships that we have today. So that is my long-winded introduction to what we're going to talk about. And Katie in our office will kind of walk you through and introduce you to each group as we go for kind of giving agency presentations and following it with who to call and finishing up with some Q&A. So with that, I'll hand it off to Katie.
Yeah, I think we are going to get started with Matt at Centerpoint. And then LPD couldn't be with us today, so I think he's going to kind of talk about what they do and what their role is as well. So Matt, go ahead and take it away.
Okay. I am Matt Martinowski. I am the critical response or coordinated critical response team lead. Sorry, that just changed not that long ago. I oversee the outreach program for Centerpoint, which we're just doing overviews, right, Katie?
Yes,
All right.
kind of an overview, what you guys do downtown and that sort of thing.
So I had, and I don't see, okay, Kate's on here too. So I had the outreach team come just so everyone could see who's who. Kate Michael is, well, on my screen to the right. Yep. Mark Fowler is another outreach worker. And then Lewis Fletcher is our outreach nurse that we have now. So for Centerpoint's outreach, we are 100% out in the field all the time. Like I said, we have outreach nursing now. We have an outreach therapist, and then we're still hiring 2 more outreach positions. And then when I'm not stuck behind a desk, I will go out as well. With all of this, Kate is the DLA, so she'll focus more on the downtown stuff. But that doesn't limit Mark to anything. Mark has some federal funding and he can go downtown too. And the 2 new outreach workers will also be able to go downtown. So we can come out, we can meet with anyone you might be struggling with or that you might think needs some help. We are obviously not police, so we can't force anyone to move. But our relationships that we've built over the years with certain individuals allows us to have conversations. And sometimes that works, sometimes it doesn't, to get them to move along. We can do assessments for housing. We can do basic needs things. We could do treatment, therapy, physical health things. Lewis is kind of the door to that. We are also going to start working with hospitals. And then the big thing that we're doing is we are partnering with LPD. And I'll do my best to explain Melissa's part in this, but for us, we will have a limited on-call, and whoever is on call that day will respond to when anybody is calling 911 or non-emergency. Those unsheltered calls or some of the mental health calls will be directed towards us, and we will go respond to those as first responders. Along with that, Melissa Ripley, Investigator Ripley, she will not be in uniform, and she focuses solely on the unsheltered population. So she'll be able to come out with us too. If we can't make it, those calls will still be directed towards officers after about 15 or 20 minutes, I believe. We're still ironing all that stuff out with dispatch. But I think that's a huge step, working with LPD, working with hospitals. Obviously, the point of everything is to help someone, to get them into a better place. But it's also hopefully going to save the city money as well, and different organizations. If you're worried about your business, then we can come down and hopefully take care of that for you. Less jail stays, less hospital issues, with Lewis coming out for all that as well. That's sort of it in a nutshell, I guess. I'm sure I've missed something because I always do, but that's what question and answers are for. So.
Thank you. And then if anybody has any questions, we'll go ahead and do that at the end. So just save them. And then when everybody's done with their presentations, we'll do that. I think next on our list, we have Matt Talbot. Is that Glenn?
Yes, can you hear me? I'm sorry.
Yes, we can hear you. If you just
Thank you.
give us an overview, that'd be awesome.
Yeah, absolutely. I'm Glenn Schwang. I'm the outreach program coordinator with Matt Talbot Kitchen and Outreach. We currently have, we'll soon to have 3 outreach staff, as well as I believe it's 6 housing/outreach workers. So we do provide outreach in the community, both downtown as well as anywhere else in the community. We are not, I guess, full-time out on the streets, but generally we are able to respond to, concerns or issues in the community in a relatively short period of time. We are staffed enough that basically if we receive a call, we're generally able to get out fairly quickly to respond to that. Like I said, we do provide our outreach out in the community at large. We also do provide, we are working to provide a kind of a street medicine program in cooperation with Clinic with a Heart, where medical care can be provided out on the streets to individuals by either a nurse practitioner or a medical doctor. That program is kind of in its infancy, but we're continuing to try to get more providers involved with that. Matt Talbot also is, for a lot of people, kind of a day shelter. So for those individuals who are unsheltered, they are always welcome to come to Matt Talbot just to get out of the elements, to receive a meal, or to receive any other services that they need. that can range everything from blankets, hygiene products, maybe they just need a shower or to do some laundry. So you know, we're always a good resource for those things. If individuals encounter someone who might need those services, they are more than welcome to direct them our way.
Okay, great. I think next on our list is Cedars, and I believe we have Christina here from Cedars. Or Christina, if you want to go ahead.
Thank you. I'm Christina Lloyd. I'm our program director for our Runaway and Homeless Youth Programming. And that includes 4 different programs. So we have our basic center programming, which is crisis intervention for families, and that's just to keep families intact and avoid any sort of out-of-home placement. And then we have our Bridges Transitional Living program. And then the Street Outreach and Youth Opportunity Center also follow under that. Runaway and Homeless Youth Programming is federal funding from the U.S. Department of Health and Human Services. So with our Street Outreach program, we're able to work with young people from 22 down to the age of 13. We have a little bit more broad definition of homelessness under RIE because we're able to include those youth that are unaccompanied minors, so maybe not residing with a parent or legal guardian, as well as those kids that are doubled up or couch surfing. So we have 2 full-time street outreach staff, but part of their responsibility is to man the Youth Opportunity Center, which is located at 1620 N Street. It's very similar to maybe what Matt Talbot does in terms of we provide a meal when we're open. We have laundry facility available for young people, and then they can come in and get food boxes, hygiene, bus passes, gas vouchers, kind of a little bit of everything. The center's only open about 25 hours a week though, because with 2 staff, we also stop to go out and conduct outreach. So we go out on the street, also looking for young people. We'll go in the downtown area and look for people, as well as like other known areas that might have youth congregating. So different parks, shopping centers, and then we work really closely with Lincoln Public Schools. We actually do outreach in currently, 6 high schools. Unfortunately, we're not in 2 of them, and that's only because of staffing on our end. We just don't have the availability to be in all the schools because they all seem to want the same day for us to be there as well. So we currently do outreach in 6 of the high schools and work really closely with the McKinney-Vento liaison. And then the staff is just available to young people at any time. So LPS might give us a call and ask us to come out and do like a housing assessment or meet with a young person to provide services. And so we will make arrangements to get a staff out to a location to meet with a young person. Much like Centerpoint and Matt Talbot, we'll do the housing assessments to get people on coordinate entry housing, and then try and provide the case management to them. Other things that the outreach team is going to do is, of course, just try and identify a safe place for a young person to go. Much like anyone else that is experiencing homelessness, we don't want them on the street or in their cars. So then working either with our own emergency shelter to put somebody there, or working with People City Mission to find them a safe place to stay for a period of time, and then provide those wraparound services and case management until housing is secured. I think that is pretty much the general overview of our Street Outreach and Youth Opportunity Center.
That's great. Thank you. I think that's all the presentations we had from agencies. I know we have some other members of the systems response group on here, so if there's anything you wanted to add, feel free. But I also have wanted to show you guys this outreach call list that we created for the businesses. We are going to be sending this out to everybody. I know when there's, someone sleeping outside of your store or somebody you think needs services, you don't always know who to call. So we created this list that includes all the agencies you heard from today, and as well as the veteran, the VA. So if you see at the top here, if you're just looking for general outreach assistance, Centerpoint and Matt Talbot, and then if you're looking for youth outreach, here are the numbers for Cedars. So we are going to be sending this out to everybody. I know Kate with Centerpoint has some physical copies that she has been handing out to businesses as she meets people. And we have more physical copies as well. So if you would like a physical copy, just let me know and we can make sure you get one. Does anybody have any questions about the call list?
I was-
Matt? Oh, go ahead.
I'm sorry. I was going to add to that it was sort of created in a way in the order of which you should call. I didn't put Centerpoint at the top because it's us, just because I feel like we probably have more availability than Glenn might have getting out. But if you can't reach us, I mean, every agency on here, we all work together really well. So.
And when you call the outreach line, how does that process work when you call that first number on there, and who answers and how's that dispatched?
So the outreach line, whoever is going to be the on-call position that day for us, that outreach line will ring directly to their phone. It's also going to be what LPD uses to contact us for dispatch calls too. But that person should be available. If not, they should respond in a timely manner. But if for whatever reason you can't get a hold of someone on that outreach line, you could call any of us. And that's just, you don't have to call in order of Kate, Mark, and me. You can call in whatever order you want. I just do everything alphabetically.
And Kate's primarily going to be the individual downtown the most. So I didn't know if we want to take this opportunity for Kate to introduce herself and kind of let us know kind of what your typical day works with, and what kind of calls you typically get, or what the wonderful work you've been doing.
Hey everybody, I'm Kate. A typical work day, I go to the library a lot, so I see Leanne a lot. I walk around downtown, meet with people at the library or at the DLA too. I'll, like, with phone calls and taking them from like anybody that's calling downtown. It can be kind of anything of like you're seeing somebody show up in like front of a business or something, and you're just kind of wondering what's going on. If like they're in service days, we can meet with people and just kind of see what's going on and talk to them. A lot of people I see often, so I know a lot of the folks that you maybe are seeing frequent the area. Yeah, that's a little bit of my day to day.
Thanks, Kate. And I know it's every day's a new adventure downtown, certainly. And again, I just want to reiterate how important it is to have the ability to have somebody like Kate out for peer-to-peer support. And I think most importantly for all of our frontline workers downtown, and especially street level workers who are unsure of any situation they see downtown. Again, I think it's hard sometimes to decipher the difference between homelessness, loitering, or what's illegal, what's not illegal. That's something that Centerpoint, Kate and her team and Matt's team can figure out for you, so you don't have to think about it too much. The last thing we want you to have your employees worry about that. So certainly making sure that your businesses forward that to your employees to understand this is probably the easiest way to go, especially if you're unsure if there's illegal activity going on or not, where most of the time the calls we get or our maintenance crew or LPD or our outreach workers are not necessarily illegal. So that's where it's become vitally important for us to have this social outreach. And it's been amazing how much they've worked with, not just trying to kick people out, but placing them into homes. And or again, even if it's situations where it's not individuals experiencing homelessness, Kate and her team are there to provide that support, whether it's just people loitering and just be able to talk to them, be like, hey, you know, this probably isn't the best thing to do, or especially if it gets a little intimidating for some. And it's just every day is different downtown, and there's going to be different groups. And I think it's just really important to understand that we do have these positions here and want to forward this. And that's one of the main reasons we did this webinar, to start the process of making sure everybody knows that the support is there, and we want to do what we can to reach out, and that we do have the wonderful staff through Centerpoint and Matt Talbot and everywhere else that can really make a difference.
With that, does anybody have any questions for any of the agencies or for DLA or anybody here on the call today?
Say, Matt, I did put a question in the chat. I didn't know if you wanted to share that with everybody or not. Maybe not.
I had just responded to you. Jeff had asked when or in what situation should the crisis team be used. They're basically just a backup. We work with the crisis team. Technically within Centerpoint, we're considered the same team. But we can do a lot of what they would come out to do. The outreach therapists actually are the crisis therapists as well. So just if you couldn't get a hold of anyone else on the list, you can call that crisis team and one of them can probably come out, or they can come out, not probably.
One more question, Matt, and just tell me to shut up if you want to. But
Shut up.
so when is it more appropriate to call Melissa, an LPD, and the outreach crisis team there, and or you and Glenn and so on? How do you make that determination as a non-outreach worker? So
with Melissa, any of the things that if we were to get called, we would also include her on that call. Whoever's on call would reach out to her, send her a text, whatever, and she could respond with us. If you're calling 911 or non-emergency, they would just include her on that dispatch that gets sent out to us. It would get sent to her and us as well. And I don't know. I'll have her contact Todd or Katie about how she would like to be contacted if you just want to reach out to her. I'm not about to give out her phone number because all I have is her personal number and she'd probably arrest me. But yeah, she'll respond to almost all the calls with us.
I'll just pile on, Matt. I know you guys have always worked, Centerpoint Street Outreach has always worked with LPD, but hasn't that become a little more formal in the past several months? The coordination with LPD.
Yeah, with the new grant that we got that added the 2 outreach workers and the nursing and therapist, LPD also created Melissa's position. So she's solely focused on the unsheltered population, which is nice. I've worked with Melissa for the last 9 years, I think. And this will just be an easier way. She won't be busy stopping people in traffic or responding to other calls.
Right.
Except for today when she had to go out to the protest. But yeah, it's just a much better relationship with LPD now. It goes for crisis as well. They have a really good relationship with LPD.
Yeah, Todd, I was just going to mention from the city side, urban development or city outside of LPD and LFR, we do not provide homeless services directly, but we are a funder. And we did make a conscious effort last year to increase street outreach staffing through some of our grants. So some of the additional staff Matt's talking about as a result of that. I also wanted to mention, probably aware that we received some pandemic funding that will be used to develop housing for the chronically homeless, 24 units. And again, that's a longer term solution. We're probably a couple couple of years from actually having that open. But I think that will have an impact on the downtown homeless presence. And there also has been some discussion about low barrier shelter. We don't necessarily have funding for that right now, but there's been some fairly in-depth discussions about that. And that will also provide some help for street outreach and downtown homelessness. So.
Kate, this is Steph Dinger. Brian at Union Bank, Brian Rowland and I work downtown, and I think it might be good to set up a time to just visit with you as we move from secured entry on the south side to the north side where we won't have secured entry. A lot of times it's not necessary to call the police, but we've seen a big increase in loitering and individuals coming, and it's a little unsettling to know, do we call the police? Obviously, if it's very urgent, we call. But we were just talking about as we move over there, we had some individuals the other day, there's a security guard, but not sure the security guard was as helpful maybe as what we could have. So we might be reaching out just to see, since we're downtown and we see this a lot, if maybe we could just set up a time to meet with you, get to know you, that sort of thing.
Yeah, absolutely. If you want to put like your email in the chat or phone.
And that was one thing I forgot to mention. If anyone on this call wanted to talk, Centerpoint, at least, I don't want to speak for Christina or Glenn, but we would be more than happy to come out and talk, whether that's outreach or the housing process or any of that. I didn't want to dig into the housing process because it can be kind of confusing if you're not part of that meeting every week.
I know the situation on the street ebbs and flows. One of the questions that we have pop up from time to time is what's maybe mainly for Matt or Kate, what's your most common call when you have people or downtown businesses calling or reaching out? What's your, over the last few months, what seems to be the most prominent situation that keeps popping up?
For downtown, I'd say it's been mostly they're noticing someone's like staying in an area and would like to see them move on or know what they're connected with, kind of thing, or to see if we can help in any way rather than calling the police.
Mm-hmm.
That would be the biggest call I get.
Great, thank you. And I mentioned before, but just want to thank Tara again for her leadership. And I know a lot of this started a few years back with the Lincoln Children's Museum. And Tara, I didn't know if you had an update or any comments to provide for the group regarding the systems response setup.
I would just say thank you for all the work that's been done on this. It's been a long time coming, and I think we're going to keep trying to work for, again, getting information out to businesses, because that's the hardest part from my standpoint, is knowing what to do. We all want to help the situation, but we're also all in the position of trying to run a business and having customers and guests and different things like that. So if you have anything else you'd like more questions on from the business standpoint, I'd be happy to be that liaison or advocate as well, because I do sit on those bi-monthly meetings.
And
so you can send me an email. I'll throw my email in the chat for if anybody wants to reach out.
how's the situation been outside your museum lately? Have there been increases, decreases, or what's that been looking like?
There has been some increases. We're seeing around the Old Amigos building. I think whenever we're getting these abandoned building areas, we're seeing them. And then in the fall, the weather change, obviously being really cold, has impacted it. But there's a lot that are finding spaces. They're sleeping amongst all the bushes and everything in Centennial Mall. So I'm sure able to kind of hunker down behind the wall of Standing Bear and things like that. There's a lot of traffic there. So again, since this cold snap for the last month and a half or so, 2 months, it's been thinner, but more around the Amigos area in the alley. But that's been kind of where the areas, and it's surprising to me. It's probably not surprising to you all, but sometimes you'll walk by and you won't realize that they're tucked in those bushes. So it can be very startling when you're walking past and they're there. But so it's been, like I said, better through the winter. We'll see what spring brings,
Mhm.
but I appreciate having the resources to be able to reach out without having to call the police each time.
Thanks, Tara.
Do we have any other questions for anybody?
I put my email and just the general outreach email, which all of the outreach team has access to, if anyone wants to reach out that way as well, or if you just want to chat.
Matt, do you mind if so I was going to send out the call list to my entire business list. Do you mind if I share your email in there too, or just the general outreach one?
No, either one's fine.
Okay, yeah, I'll do that.
And we will record this, like Katie said, and so we'll be able to forward this if you have a peer, and we have a lot of businesses that weren't able to make it today that wanted the recording as well. So we'll be able to forward this, and we did this a couple years back, and we'll be able to post this on our website as well, so people can meet everybody that talked today and get a better understanding. Because I know it's one thing to have a call sheet, but it's another thing to hear from the groups that are actually working on this and out on the streets. So I think that'll be really helpful.
Does anybody have any like safety or security resources or tips that they'd be willing to share? I know Bennett Martin's had it really rough the last couple of months. I know that we kind of go through waves with what's going on, but it's been real constant recently, and some of them are excuse me, a lot more potentially physically dangerous to my staff. So if anybody has any resources, I'd even just to email me, I'd love to have them.
I would second that as well. I am looking always for staff training, especially as we get more into the spring and summer, for how to not only de-escalate, but just navigate safely and what responses.
If that may be something that we could put on as a continuum of care at one of our regular meetings, and invite a wider group if you'd like. I know we can get some folks who can speak to that, unless Christina or Matt or Glenn or you guys have somebody in mind already.
Personally, I'm probably the last person to talk to about safety. I'm not the best at that, I guess. But we can create a list. And then if Jeff, you don't do a training, I can probably pull some things up that would work as a training for everybody.
We could probably help too. We have a pretty robust training that all staff have to go through, and some of that includes outreach worker safety. So Matt, maybe we could connect and I can share our training with you, and we could put something together specific because it would include not just our outreach team in that training, but anyone that's going into family homes by themselves. So Matt, we could probably connect and do something.
Yeah, ours is pretty similar to that too. It's all of Centerpoint, de-escalating trainings and things like that. So I've taken them all. I'm just still not the safest.
I think this would be great. That's a good point, Jeff. I think if we add this as part of one of our upcoming agendas for the systems response and invite everybody here, but then also have that recorded so we can post it on our website. So they not only have introductions here on what to do, and then also a second video on this training and some tips there. So I think having those both hand in hand would be extremely helpful.
And we do primarily, excuse me, our required trainings are online, and unfortunately I can't think of what it's called right now, but I'm more than happy to also work on that with Matt and Christina if you need any assistance.
All right, any last minute questions before we let everybody go? Okay, I don't hear anything. So thank you, everybody, for coming. This is, like I said, recorded. So if you'd like to share it with anybody, feel free. We'll be getting it up on our website later this week. I'm going to be sending out the call list and some email addresses to everybody here, as well as our full business list. But yeah, if you have any questions later, don't hesitate to reach out to any of us.
Thanks, everybody.
Thank you.
Thank
Thank you.
Thank you.